Muitíssimo obrigado, ministra, por esta condecoração. E a recebo em nome de meus colegas.
And thank you for the recognition. I think there is a long, if I read every dignitary, I'm really glad that we have many dignitaries in this very important initiative. It would take quite a while, but I will try to package it maybe by some areas. Of course, Your Excellency, Minister Nisia Trinidad, and my sister, Excellencies, Ministers, Honorable Members of Parliament, heads of agencies, civil society leaders, private sector leaders, and of course, I would like to recognize my regional director and my brother Jarbas Barbosa, and especially someone who touched me while speaking now, Adjane Oliveira. Thank you very much. I can understand how it feels to live with disability. I just recovered from a broken foot. And as soon as my foot was broken, I had to be on a wheelchair. And I started to feel irritated. And normally people tell me you're calm. But when I was put on wheelchair, I was starting to show some new behaviors and irritation. And I couldn't believe actually to myself how difficult it is, even if you try it for just a few weeks. And then you saw me with a cane and now with a trainer shoe, so I'm getting better. But I think very often some problems like Ajana has and many, it's when we face it, when we experience it, that we understand even better what it really means. So I fully understand Ajana. And the other thing that impressed me is, which is going to be a very good support for the initiative we're launching today, are all the movements she mentioned. HIV, TB, Hansen or leprosy, hepatitis, Chagas, HTLV, and all the movements are in the room. I think that will give energy to the 12 disease elimination plan. And of course, thank you for your work so far. I think it's your advocacy also that convinced, I believe, the government to really come up with this package of 12 diseases. So it cannot be done just by the government. I think the movements are going to help realize the goal that's set by the government. So I just want to recognize. And then there is one other recognition. This is on autistic artist from Brazil. His name is João Pedro de Oliveira Merces. We became friends on Twitter. He is a very good artist and representing Brazil very, very well. It's just amazing. Maybe you know him. I had a plan to see him in person, but he lives in Bahia State, so he's a bit far away from here. Sorry? Bahia. You're from Bahia? Okay. So anyway, I'm coming back for the G20 meeting, so we have agreed with João Pedro to meet him during the G20 meetings. But I wanted to use this opportunity to recognize his work. He's autistic artist, and incredible work he does. Disability, they say, is another form of ability. And if people can really release their potential, disability cannot limit them. But at the same time, there are many social inequalities and stigma, but the society should also help them. But I wanted to use this opportunity when I couldn't meet my friend, my Twitter friend, to say hello and bonjour from here. Thank you very much. And if he's watching this, hope to see you soon, my friend, Joao Pedro de Oliveira Merces. And again, I say bonjour, and I will go to my speech I have just started. I know many speakers, but I hope you will bear with me because this is a very important initiative. It's such a great honor to be here in Brasilia for this important moment. I thank His Excellency President Lula and my sister, Minister Nícia Trinidad, and the government and people of Brazil for their hospitality. But more importantly, for their commitment to promoting and protecting the health of Brazil's people. Brazil's leadership on health is especially important this year as you assume the presidency of the G20. And I look forward to coming back to Brazil during the course of the year. It's for this reason that I'm very encouraged by Brazil's national plan for the elimination of socially determined diseases. This plan is a bold statement of intent, truly bold. And it's, I can say, my favorite kind of plan, ambitious but achievable, but at the same time, that's going to address the roots of the problem, the social determinants. As Madame Oliveira said, the inequalities. And of course, it should be ambitious because what is at stake is the most precious thing of all, human life. But Brazil's work is not starting today. Brazil has already taken several big strides down this road. In particular, I welcome Brazil's commitment to end TB by 2030, 5 years ahead of schedule. And the Stop TB Partnership is here holding its board meeting, and they're very happy by this news because they want to accelerate things. And Lucica is saying, agree. And WHO was also pleased to receive Brazil's dossier for the elimination of lymphatic filariasis at the end of last year, as Ethel said earlier in her speech, the Secretary of Health. And we welcome the National HIV Elimination Plan that you're announcing this week. I also greatly appreciate Minister Nícia Trinidad's agreement to co-chair the WHO TB Vaccine Accelerator Council, which we launched last year. And by the way, Minister Budi, who is the other co-chair of the accelerator, is also a member of the Stop TB Partnership. So we're trying to align, which I think will have a big impact. And the success of a vaccine for TB will be a game changer. And I'm really glad that very important discussion is happening in Brazil, which is the right place, given the strong commitment of the government to eliminate TB. And also, it's not one of the 12 diseases in this plan. I also commend Brazil for its commitment to cervical cancer elimination, with the launch of its national elimination plan just last year. These commitments build on Brazil's significant achievements in recent decades. Since the turn of the century, Brazil has achieved a significant reduction in preventable premature mortality, and infant mortality has more than halved. Brazil also has a proud track record in responding to outbreaks of infectious diseases, including Zika, dengue, and influenza. These achievements are built on a strong health system, from primary care to specialized clinics and referral hospitals, with one of the strongest surveillance systems in the world. In Fiocruz, Brazil is also home to one of the world's leading public health research institutions. By the way, I have been working with Fiocruz for many years, since I was minister in Ethiopia, Minister of Health, and such a great institution that Brazil has. And of course, Bio Maninos is one of 15 vaccine manufacturers that's participating in the WHO mRNA technology transfer hub. On capacity building, on vaccines, as you know, we work very closely with Gavi, and I'm very glad to have here with us the board chair of Gavi, my good friend Jose Barroso, the former EU Commission President. And former WHO, the former Gavi CEO is also, you have become already former, Seth Berkley is also with us. Of course, Sania is not here, she's just starting, but I think through the chair, we have the commitment. And working with Brazil on especially vaccines will be important, since Brazil has a huge capacity. WHO is also working with Butantan to explore a new collaboration to accelerate local production of new and advanced vaccines in Brazil. But like many countries, Brazil also faces significant challenges from both non-communicable and communicable diseases, including the current outbreak of dengue, which is being fueled by the El Nino phenomena. In fact, this outbreak of dengue is part of a global surge in dengue, with more than 5 million cases and more than 5,000 reported last year from 80 countries in every region in the world, except the Euro region. All regions are affected by dengue outbreak as we speak. So it's a global upsurge. I commend Brazil for its response to the outbreak and for its leadership in introducing the new dengue vaccine in more than 500 municipalities. The outbreak demonstrates the need to continue strengthening the health system and epidemic and pandemic preparedness and response. It also demonstrates that we cannot properly address the health of populations one disease at a time. We need a holistic response that puts people at the center of health systems and services, not diseases. I will repeat this. We need a holistic response that puts people at the center of health systems and services, not diseases. By the way, I'm really glad also that African Union is represented at a senior delegation. My sister, Ambassador Minata Samate, is here because the experience in Brazil will also help Africa, the South-South cooperation, because there are many things that you share. And the holistic approach is what this plan is all about. And that could be a model for many countries, and as I said, the African Union as a whole, but for many countries in the South. And for WHO, it's an opportunity because we can share the experience here or the best practice with other countries. Eliminating a disease is one of the greatest gifts a government can give to its people. Not every disease can be eliminated, but the 12 diseases you have chosen can be. We have the tools, we have the know-how. The reasons these diseases are not eliminated are largely social, not scientific. They are about the conditions in which people live and work, their gender, the risks to which they are exposed, stigma and discrimination, and more. In fact, these 12 diseases have a symbolic relationship with poverty and inequity. I think Madame Oliveira had said it very, very well. They feed on it and they fuel it. They feed on poverty and inequity, and they fuel it also. These diseases are emblematic of inequity. In recent decades, we have made incredible progress against many of these diseases. But more recently, progress has stalled, in part due to the disruption caused by COVID-19. The pandemic laid bare many of the same underlying inequities that fuel these 12 diseases and hinder their elimination. This plan recognized that many of the same diseases afflict the same communities because they suffer from the same inequalities. But it also recognized that while disease-specific interventions are important and necessary, many of these diseases can be prevented and managed at the primary health care level with common tools. The same clinic that provides services for HIV can and should provide services for syphilis. The same health worker who recognizes the symptoms of trachoma can be trained to identify the symptoms of tuberculosis. The same lab that processes tests for malaria can process tests for hepatitis. And same pharmacy that dispenses medicines for one disease can dispense them for others. In fact, if implemented, this plan will deliver health benefits beyond the 12 diseases. And it will deliver dividends beyond health in poverty reduction, social equality, and economic prosperity. In other words, this plan is a plan for a healthier Brazil, but also for a fairer Brazil. And then before I close, I would like to recognize also Brazil's role globally. I don't know how many of you know, but Brazil has contributed in the formation of UNITAID. And the UNITAID CEO, we have him here in the room, Philip. And one thing maybe, in addition to that, is wanted to recognize one person who has been involved in the first phase of the negotiation from Brazil, Ambassador Celso Amorim. And just wanted to recognize not only you have made progress locally and you want to do even more through these 12 packages, but you're contributing as well globally. And please continue to do that. And thank you for your contribution and support to WHO, to Gavi and UNITAID. It comes from your commitment to multilateral organizations, not only in supporting them, of course, including in creating them like UNITAID. So once again, I congratulate Brazil for its vision and commitment to health at home and to its leadership regionally and globally. As G20 president this year, and BRICS president in 2025, we even expect more from Brazil. And all the best of success to Brazil. And you can count on WHO's total support. Obrigado. I thank you.
Gostaríamos de registrar e
We would like to register the presence of the executive directors of UNITAD, Philip Duritan from Stop TB, Lucica, and the representative of UNICEF in Brazil, Youssef Baudinho. Now we have the State Minister